Yeah. Good afternoon, team. I think we can begin. Otieno, confirm if we can proceed.
Yeah, I think we are good. Let's start.
Okay. All right. So, good afternoon, team. Welcome again to our virtual KenyaEMR training. My name is Franklin Songok. I think you're all aware that we've always done this previously, and these trainings are organized courtesy of a concerted effort between the HIS team and of course in NASCOP and Palladium team, who are supporting the Minister of Health with in HIS. So I want to kindly request especially those colleagues who have the mic to lead us in a word of prayer before we begin. Moses, are you in a position to say a short prayer?
Songoka, can you hear me?
Loud and clear, Moses, proceed.
So let us believe and pray. Father, in the mighty name of Jesus Christ, to come before thy throne of grace with thanksgiving, we thank you for this opportunity that you've granted us to be able to just learn from this tree, from your tree of knowledge. We pray and commit the presenters unto your hands. We pray that we might have a smooth session. We come against all the powers of the enemy that may come through to interruptions in internet connectivity or even power. We pray that you may grant us just a smooth one. I pray this short prayer, believing and trusting in your Son, Jesus Christ. Amen.
Amen, and thank you very much, Moses. So I want to skip the preliminaries. We can do this after our training, but I'll just go straight to just quickly taking us through our agenda for the day. And before I do that, I want to mention that today our main topic is basically to discuss KenyaEMR3.x HIE features. HIE in full is Health Information Exchange, and we are looking at leveraging integration for effective patient management. Basically, that's our theme for the day. So allow me to just share the agenda so that I can just quickly walk you through as we plan to begin. Just give me a minute. Okay. Okay, confirm you can see my screen. Agenda Moses of Frida, confirm you can see my screen.
Your screen is up, Songo.
You can see your screen, Franklin.
Thank you very much, Moses and Frida, for confirming that. Yeah, so this is our agenda for the day. Of course, our expectation is that today there are three items that we need to achieve. One is to describe the key features of KenyaEMR3.x that utilize the Health Information Exchange, that's the HIE platform. We'll also be able to take our time to explain how these features enhance patient care facilities, and of course determine your facility eligibility status for implementing the SHA process. So we intend to do this in two formats. One is through a slide deck, which will form just part of an introduction to HIE, that's the Health Information Exchange. So Otieno will take us through that part. You will also be able to cover the value proposition, the importance for HIE and you'll also be able to just mention about some of the features that will leverage between, the KenyaEMR features that will leverage HIE platform. And finally, Eric Mudomi and Patrick Wango will take us through a demo. That demo will cover the various parts as indicated there. So one is just looking at the integration between KenyaEMR and client registry, the health worker registry, the Kenya Health Facility Registry, and then patient share validation features. So once that is done, we will give you an opportunity to ask any questions that you may have regarding the walkthrough or regarding the presentation. And then after that, we should be able to close. So one quick announcement, kindly, if you have any questions, we have a team. During the presentations, if you have any questions that you feel probably you want to seek for further clarifications on, kindly let's utilize the chat box or the Q&A chat box to ask those questions. We have a team that is available to respond to any of your questions. However, we'll also give you an opportunity, just like you've seen in the agenda, we'll give you an opportunity to ask your questions, and the team will be able to respond. So at this point, I want to request Otieno to take us through the first part of the presentation. However, before we go there, I'm not sure whether I don't know whether we have the county teams in the call. We can maybe just allow one or two people to say a word before we begin. I don't know, do we have any Casco in the call? You can raise your hand. We'll give you the mic, or any CHRIO before we begin. Any CHRIO or Casco, you can raise your hand if you're in, please. Okay, it's fine. I think if any one of our colleagues joins, we will give them an opportunity to just say one or two words before we close. So at this point, I want to welcome Otieno. Otieno, once you're done with your slide deck, I will request that. Oh, okay. Someone is saying they can't hear me. Moses, you can hear me?
Loud and clear.
Yeah, so I think Faustin, you may need to probably exit then rejoin. Yeah, because I think Faustin, Joshua Muya, seems you can't hear me also. Apparently, when I speak, you can't hear me, but I would suggest that Shalom, thanks for confirming that you can hear me. So maybe Moses, you can help to respond to Faustin and Joshua to probably maybe exit and rejoin. Meanwhile, Otieno, over to you. Once you're done, I wanted to say that once you're done, you can usher in Eric. I don't know that it's Eric or Patrick who will start. We'll go first. So usher in Eric or Patrick, whoever will go first. And then after that, I'll come in to moderate the Q&A session. So over to you, Otieno.
Thank you very much, Songok. Please confirm if you can hear me and if you are able to see my screen.
Yes, Otieno, I can hear you and I can see your screen. I'm wondering why there's a good number of participants who can't hear me. But I'm thinking probably it's because of network. Anyway, proceed, Otieno.
All right. Thank you, Songok, and good afternoon, everyone. Thank you for finding time to join us this afternoon. Our topic today is to just share with you some of those important features within KenyaEMR3.x that leverages the HIE, the Health Information Exchange platform. So it will be good to just introduce this and also give way for the demo. So at first, I think I'll just start by giving a short introduction to this. So my short presentation will gravitate around the objectives and then introduction to Health Information Exchange, what value it portends to different actors within our space, and also some of the features that have been built within KenyaEMR to leverage those HIE platform functionalities. After that, we'll give it to my colleague, Mudomi and Patrick, to just take us through the actual demo. So the objective of the day is simply to describe the key features of KenyaEMR that are utilizing the HIE platform. we'll try and explain how these features enhance patient care and support seamless health information exchange across different platforms or different shared health utilities. And lastly, we'll try and show you how going forward you'll be able to determine if your facility is SHA compliant and it is able to provide services within that kind of framework. Yeah, so a short background on this. One, as part of government's effort to achieve the universal health coverage, there was a need to kind of come up with reform, especially in public health systems, to ensure that there was kind of what we would call standards. And one of the major shifts that was involved in this was to move away from the fragmented health information systems and adopt more standardized systems that encompasses everything from support for the community health units all the way to the primary referral hospital levels. And to facilitate this, the government established a standardized health information system, health information exchange platform that kind of streamlines the national exchange of digital health information. And this leverages shared health utilities. And one of those utilities, as you'll find out shortly, is the Common Terminology Service to ensure that all the systems within that have been approved for implementation within the country speak sort of the same language. Therefore, KenyaEMR being one of the approved systems in the country, approved EMR systems in the country, fully complies with these requirements and these standards, and it seamlessly integrates with the Health Information Exchange platform to consume all these national health, shared health utilities that I've talked about. So the question is, what is Health Information Exchange? So Health Information Exchange is the electronic sharing of patient health information among healthcare providers, facilities, public health agencies, and it ensures that critical medical data is available securely and in near real time to ensure that there is improved patient care. So HIE is very important. Health Information Exchange platform is very important in helping reduce duplication of services, improving care coordination among care providers, and it kind of goes a long way also in improving the clinical decision making while giving flexibility and control of the data privacy and security to individual patients, which this information belongs to essentially. So it complies with the government vision to establish national digital health superhighway. I'm sure most of you have heard that before, where we have like a national framework, digital health highway, that kind of controls how systems integrate and shares information from way at the facility, bottom at the facility all the way to the national level. So with this, the government developed a digital health information exchange platform for health information exchange among different systems. And this information exchange, as you'll find, is achieved through various international standards, like for instance, the FHIR and HL7 are some of the standards that have been used to establish the health information exchange. So what are some of these national shared health utilities that KenyaEMR is leveraging on? So one of these is the health, the client registry, CR. You remember, I think most of us remember when we were talking about NUPI and NUPI registration, NUPI validation. Much of the time we were talking about the client registry, where it was a whole database of all the patients within the country. at the time that were receiving HIV care within the country. But then this has since been expanded beyond that to mean that you have a client registry of all the patients in the country, regardless of the service of the type of service that they receive. Then we have another utility called the Health Workers Registry. It's a registry that contains a list of all the healthcare workers within the country, because it will be good to know, it will be good to identify the patient and then identify the provider and then identify the facilities where these patients receive care. So there is another registry called the Kenya Health Facility Registry that's also part of the National Shared Health Utilities. There is electronic claims management service for e-claims, and again there is the Kenya National Health Technology Service, which I've talked about, which ensures that different systems can understand each other. They can speak quote unquote same language. And again, also we have the National Shared Health Records, especially for information exchange between different systems. So in effect, you'll find that in KenyaEMR, we no longer validate a patient information through NUPI. And I think most of you have tried that. It fails because that is part of the transition from the NUPI-based validation to now the client registry-based validation. And I think during the demo, we'll be able to see how that works. Yeah, so the client registry is now part of the shared national health utilities and is availed automatically as part of the patient registration information that KenyaEMR consumes from the Health Information Exchange platform. Yeah, so this is just a diagram that was developed by the ministry that just depicts and illustrates how different systems are interdependent within the space and how they are able to exchange data all the way from the primary level to the national level. And the part I think which is very important for us is the middle part, which we are talking about the National Core Digital Health Services that the systems, the EMRs will leverage, and they consume the data, they share the data with these particular platforms. So I've talked about the Kenya Client Registry as part of the National Shared Utilities. I've talked about the Kenya Health Workers Registry, Kenya Health Facility Registry, Kenya Community Health Unit Registry, Kenya National Health Technology Service, and also the National Shared Health Records. And also within that same space, we have the National Health Information Services like the e-claims, the telemedicine, and also the logistic support, the logistic and supply chain management service for commodity management. Yeah, so if you look at it as it is, it shows the national shared utilities in the Kenya National Health Information Exchange, and also it is good to emphasize at this point that all these features have been enhanced in KenyaEMR, and you'll be able to see how KenyaEMR is able to interact with some of these particular shared health utilities. Yeah, so why I care about HIE, especially in our use case, one of the things I talked about earlier was that it brings benefit to different actors within the digital health space. And for our presentation, we just look at three, which is now the provider, the patient, and the facility itself. What are some of the benefits that they may reap from adopting the system that leverages the exchange platform, the health information exchange platform? So one of them is the better care coordination and reduced clinical errors, and the cost effectiveness, which by reducing the duplicity of process and procedures. The facility healthcare providers will experience the cost effectiveness in kind of discharging their responsibilities and also providing care to this particular patient. And by adopting this, it complies with the national requirement, especially for patients' identification through SHA, which we'll be able to see. And to patients, they'll be able to experience faster, safer treatment through access to patient medical history, convenience, and also empowering the patient to take full control of their health information data. And we'll be seeing how that works through different approaches, biometrics, OTP, and all, and also to facilities will be able to experience increased efficiencies due to workflow streamlining, and with that, they'll be able to improve on their services to patient, and of course enforce standardization in health terminologies to ensure that regardless of which platform the patient has been seen on, they'll be able to access the historical data of this patient regardless of the location. So those are some of just the few value propositions that we get by adopting the standard-based approach and also leveraging the health information exchange platform. So at this point, I'll just pause and give the mic to my colleague Mubomi to just now kind of show us this and how this is working within KenyaEMR. So I don't know, Eric, if you are ready so that I can stop sharing my screen.
Thank you, Otieno. Confirm that you can be able to hear me.
Yes, I can hear you.
Thank you. So I'll be taking through the integrations that have been done within the KenyaEMR Taifa Care version, what Otieno was talking about. So allow me to share my screen. Otieno, confirm that you can be able to see my screen.
Yes, I can see it.
Okay, thank you. So I'll be taking you through the integrations that have been done concerning the HIE, and I don't want to repeat what Sonkoke and Otieno just mentioned earlier concerning what HIE entails in it, but I just now want to show you through the system what has been done. So number one, the change that you can be able to see, it's the login page now coming in with the Taifa Care logo there, the name. So it's still the KenyaEMR, but the Taifa Care version. So this is something that you'll be able to see for those facilities that haven't upgraded to this particular version. So allow me to log in so that I can start with the first one, which is the integration with the health worker registry. And now we can be able to show you when we talk about the value that it has for our healthcare workers, what does it entail and what are we supposed to do within the KenyaEMR? So just allow me to log in as an admin. So mostly what happens within this particular version, when you log in, you need to select the location where you'll be offering your services from. So right now, allow me to choose Wamagana Health Center, and then I can be able to confirm so that I can be able to get to the next page, which is the KenyaEMR homepage. So the first one that I've talked about, which is the health worker registry. This is whereby each and every healthcare worker who is a provider at the facility needs to be given the login credentials so that can be able to access the system and even can be able to offer services to our patients or the clients within the facility. So how do we go about it with the HIE? So what you're supposed to do once you get, or the person who is assigning, mostly I know these are all given to the facility admins. Once you log in, you locate the KenyaEMR modules, which is at the top right of your screen. When you click on it, you'll be able to see various modules. You can be able to search for administration. Once you locate the administration, you need to click on that administration. So what you'll be able to see on this particular page, these are the existing users that have login credentials for this particular server. Remember, for this version, we're only upgrading what we have within the facilities. So this is very likely to be able to see users, the previous users who have been using this particular system. So I have two use cases that I want to show you what to do at the facility level once we get this particular version. So number one, it's for the first time person who does not exist. This is a user who does not exist within the system. How do we go about it? So when you locate at the right hand side, you can be able to see where we have the filter by, and then alongside that you can be able to see add user. So on this is where you can be able to add your user, and when you click on the add user, this form of adding a user will be able to pop up. It has the 4 sections, whereby the first section it's demographic information. The second one is whereby you'll be able to set up the login information, and this is whereby you need to set the username and even the password that this particular user will be using. And then we have the provider account and the roles that this particular user can be able to perform. You'll be able to see these as we'll be going through it. Now, for the health worker registry verification, this version has been integrated with the HIE, whereby we know at the facility level, most of the healthcare workers need to have been registered with the various regulatory bodies, and they are given the licenses. So what the guidance is, we can be able to choose the identification type of the identification that we would want to use. Do you want to use your ID number for you to be able to create this user? Do you want to get the registration number? And this is the registration number that is given by your various bodies. Or do you want to use passport number? But for the passport number, this is whereby you want to take the national ID number from that passport. So if, for example, let me use a use case of a national ID number, then on the identifier number, then this is whereby you need to key in the number. So for this use case, I'm going to use an ID number that we've got a consent from one of the health providers. Then once you key in this ID number, then you can be able to click on where my cursor is. So I'll be requesting you to be able to follow up my cursor so that we can be able to understand the entire process. So just click on that. Then we can be able to see the system is pulling that data. So what the system does, it pulls your data from the HIE. Then you'll be able to see the health worker information found in the registry. And then do you want to use the information to continue with registration? So remember this particular process, we're still creating a user within the system. So you can be able to see the health worker name, the provider unique number, and this number is very much important because if we were to claim, and remember all these integrations, by the end of it all, we need to be able to claim from using the SHA. So this is one of the number or the identifier that will be able to get that claim be fulfilled from the SHA side. So why are we doing all this and pulling this information? It's because the government wants to eliminate the quacks in offering the services. And for your claim to be valid, it needs to have been requested, or the service has been to have been done by a qualified personnel. So even the board registration number, the license number, UID number that we used, and the renewal date, the licensing body, and the validity. Disclaimer for this, there is something that is being done on the license validity. We've noticed that the information that we are getting from HIE, it has some discrepancies here. So this will be worked on. So once you pull and verify that this is the right information of the user that you want to create, then you can either cancel, and cancel is used whereby the information that does not match with the person whom you want to make a user or a provider within this version. But if this does match, then you can be able to click on the used values. Then the system will now be able to auto-fill for you the given middle number, the family name, and then you can be able to select here the sex. This is a female. Then next, it takes you to the login information. Automatically, if a username has been taken, the system will be able to highlight it for you. So allow me to use that as our username, and then here you'll be able to give password. Then you confirm. So the two passwords need to match for you to be able to proceed. Then there is another feature that we'll be bringing in whereby forcing the password change that optionally require this user to change their password on the next login. It has its own use case whereby if this is checked in, it means once this particular user logs in, we'll need now to change the password so that it can only be the user is the one who knows the password. We need to track even how we are using the system. Then after that, you'll be able to see under the provider details. This will automatically autofill from what we fill from HIE. You'll be able to see the unique identifier. This is the number that I talked about being very crucial when it comes to claiming. The national ID number, license number, the registration number, you'll be able to see all that, and even the expiry date of that particular license. Then I need you to take note on this, the provider details. We need to check on this so that we can be able to make our user a provider in this particular system. That means once we do this or we click on this, the user will be able now to offer services. Then you click on the next. There's another part on the roles. So we want to simplify this further. So the way we've done it, not like how we used to do it in 2.x, so that you can be able to make it user friendly. So for example, if our user is a doctor, you can be able to select, or a nurse, you can be able to select, or maybe a nutritionist, you can be able to select. So you'll be having all the roles here so that you can be able to assign them accordingly. So allow me to use nurse. Then after that, I'll save, and that marks the end of assigning login credentials for a new user who didn't exist within that particular system. And if you try to search, even using the ID, I think the ID that we were using, you can be able to get our user. Let me expand this. So we can be able to see our user here, and you can be able to even search. You'll be able to see the user and the other details that we recorded. Then you can be able to expand here and be able to see more of the details, the expiration, the expiry date of that, the registration number. When you click on the view roles, you'll be able to see the role of this particular user. So that is one use case for the first time. So what about when we get this particular system? We may be able to see an existing user within the system. What should we be able to do so that that particular provider can be able to claim for any chargeable or billable service? So for example, let me just take the first one here, and we notice that we don't have even the license number or the details that are required for us to be able to claim. So when you navigate to the same page where we are, then search for your user that you want to edit. Then under the actions, where my cursor is, you can be able to click on the actions. And then from here, you can be able to edit this particular user. When you click on the edit user, it takes us back where we started, but now with the information of the user that we want now to update. Up to this, it will now be very simple. Just search using an ID number, just the same process, and then update. Once you accept, then it will be able to update the systems, the information, and then you can be able to save and close. So that is the first one, whereby the system has now been integrated with the to be able to take care of the health worker registry. Moving to the second one. For us not to be able again to be able to claim, we need to make a follow-up on our facility, on our facility has it been accredited to be able to make a claim under SHA. Again, it is within the same page, whereby now you navigate on the left panel, where we have the facility details. Basically, there is not much that is needed for us at the facility level, but to monitor. So when you click on the facility details, you'll be able to see information for this particular facility. And to start with, you'll be able to see the general information, and that is the facility name, the level of that particular facility, the KMHFR code, SHA information with the facility registry code, the license number for that particular facility, the SHA status, the SHA contracted status and the expiry date of that particular contractual agreement that this particular facility has with the SHA team. So what is of major importance here? It's now the facility registry code. Remember, we need to monitor at our facility so that we ensure that once we start event claiming using this particular version, we need to get the right information for our facility. So at the first time, if we do not get the right information, that is when we are required to synchronize with HIE. So once you click on the synchronize with HIE, what happens? The system pulls the right information for this particular facility, and then you'll be able to update. And the facility registry code, this one will be very much important, and the status when you'll be claiming for your billable services, or maybe the billable services. So this is the second integration that has been done. Then moving now to what Otieno was talking about, we used to verify our users there before getting NOPE. Right now, that one has been changed because what are we supposed to do within the facility when now a patient walks into the facility? Right now, it is required of us to start by searching a patient. And for us to be able to search here, we are supposed to use an ID number. So allow me to have two use cases here. The first use case that I'll be able to show, it's a patient who is coming to seek for services after you've upgraded to this particular version, who has never even attended any service at this particular service. And for this, allow me to use an ID number. This is my ID number for data protection purposes. I've given consent. So you're supposed not to key in your ID number. Then the system will be able to do a lookup to search. Then you're supposed to click on the search because it has been connected with the HIE, and I have my details existing in the SHA or the new client registry. Then it will be able to do a lookup using my ID number, and then it can be able now to pull my information so that you can be able to proceed to offer services. So the first time you could be able to see when I keyed my ID number, ETN, to say that, sorry, no patient chats were found, meaning that I do not exist within this particular version of this system. So what you're supposed to do when it tells you, sorry, no patient chats were found, whereby you need to select an identifier type. So when you expand on this, there are various identifier types that you can be able to select from depending on what we key in. So what I've used here is my ID, so I'll pick the national ID, and immediately I do that, it will be able now to pull my information from, or show my information from the Afya Yangu, that is the registry section on the HIE. And you can be able to see my name has been masked, and then you can be able to see that it is from HIE and some of the information. And again, you can even be able to click on the show more, whereby you'll be able to see my dependents within that particular platform. So if I'm the one who is to get services in this facility, then I need to give consent so that they can be able to, or the provider can be able to continue accessing more of my information and offer services. So there's something that we need to take it to be able to understand the process here. So once we key in the ID number, then you'll be able to see this information. But before I access this information, I need to get consent from the patient. What happens when you say OTP verification? Then there will that pop-up that will appear with my phone number there, and then I can request for OTP. So if then you'll be able to see this particular notification that the OTP has been sent. So allow me to take it from my phone. So if the patient wants you to continue accessing the information and offering services, then he or she will be able to give you the OTP. If he doesn't want that, then he can decline, and then you can be able to cancel, but you'll not be able to proceed because the patient has not given you the consent to proceed. So allow me to key in. Then I'll continue to chat. So what it happens, it will take you direct to the patient now homepage. So it will be as simple as this. I know there before we were used to get to the registration form, we fill all that information. But right now what will be happening is that we will now need only to come to the search patient, enter the valid ID number, then it will be able to pull your information from the HIE, and you'll be able to see some of the information, the national ID number that we used, my SHA number, and even the CR number, and even my SHA number. So right now you'll be able to see the difference between the two. It is now the prefix whereby you have the CR and then the number, then we have the SHA and then the number. And like there before, we used to have NUPI and number, which is now CR. Then added another one, which is the SHA that is supposed to be used when claiming. Then before I proceed to show you on another thing that we're calling the patient SHA validation, let me take another use case. So the next use case that I want to show you, it's because we know KenyaEMR has been running in our facilities. And once we upgrade this particular version, we are saying it's not a new system, it is the KenyaEMR that we've been using, only that we'll be upgrading KenyaEMR with Taifa Care version. You'll be able to see some existing the patient, or maybe some of the patients that we used to have. What will be happening? We need to start from the same by searching the patient. We use the ID number, and here we need to use the right ID numbers. So allow me to use my colleague's ID number. I'm just getting the ID number. Yeah, so I'm using an ID number, and upon searching, I can be able to see that ID number. Previously, it was used before we upgraded to Taifa Care, and then I'll be able to see the name that was associated with this particular ID number. And once I have confirmed that that is the right ID number, then I can be able to click on the name of that particular patient. So what does this particular system do? It will be able to show you your local patient who was there before this particular search, and then the right information from the HIE. So it compares, and you'll be able to see this particular message there telling you about the differences found. This message just only tells you that there is a difference between the two names, or maybe the two details, but using the same ID number. So this is the reason as why I said we need to get the right ID number and then be able to see whether that information is the right information. So what next? Let's say, for example, you have confirmed this is the right ID number, it's true, and this is now the right information, even from the ID card, but whatever was there before, let's say it was not the right name. What am I supposed to do next? Number one, there is cancel, but if you cancel, you'll not even be able to proceed and offer services to this particular patient. Number two, there is proceed to patient chat. What it means, when I click proceed to patient chat, I can try this. It will take you retaining the local information that was there, so that if there is anything that you want to do on the whatever was there, like for example, if it was the ID number was wrong, or even the name, you can be able to click under the actions, and then you can be able to edit patient details. So the third one, so yeah, you'll need again to get back to the search so that I can be able to show you about. So on the third one, it's about syncing and continue to chat. So what happens when I sync and continue to chat? Then now it will be able to take this information, which is the right information from the HIE, if I have confirmed even using the ID number, the identity card, and then replaces this information with whatever is here. So for example, you can be able to see here it is Kemani Ibrahim, only one name which is matching, but the rest one, this is not the right name. So when I say sync and continue to chat, now you'll be able to see it is now changing the name to the right details. So this is now the second use case that I know we may be able to encounter, or we may encounter at our facilities. Now, getting to the last one. For this particular system, another integration that has happened, that has been developed within the system, it's whereby we know it helps us to be able to claim. So on the claiming processes, once we access the patient chart, this is whereby you're supposed to offer the services. We are supposed to initiate a service. Currently at the facilities whereby, let's say we have SHA agents, I know there is how they are doing the lookup using the SHA portal. They can be able to do the lookup. They select the even the interventions. So the same has been integrated within KenyaEMR3.x version so that you can be able to make that seamless. How does that happen? So while on the patient chart, you navigate to the top right where we have the actions. When you click on that, you'll be able to see add visit. And this add visit is whereby we want to start a visit for this particular encounter we have with our patient. And when you click on it, then the system asks you whether is it a new, ongoing, or in the past. So for now, allow me to take new because it's a visit, it's a today's visit. Then be able to see the name of that facility and then the visit type. What type of a visit is it? So let me to pick outpatient. And then under the billing, is patient exempted from payment? So I want to say no to show you how can I be able to even do the lookup within KenyaEMR. Then the payment method, this is how I need now to specify this is insurance. And then under the insurance scheme, I'll pick SHA. So what the system, they immediately take SHA, the system does the lookup. It can be able to give you the policy number and tells you about your SHA status. So for example, you can be able to see this one is active and some of the funds or where I can be able to get services, and PHC being one of them, and then you can be able to see that being active. Then from there, then I'll be required now to take the package. So for example, let me hit it's outpatient. Then it will be able to load interventions. Then I can take want to take consultation, and again you can be able to take more than one. This is a multi-select. Then after that, then now you can be able to proceed using even the queue service. So what I just wanted to emphasize on this particular section whereby through this integration with the HIE, the system can be able to, when you select payment method will be insurance, then you the scheme will be SHA, then it will be able to do a lookup for you and tell you the status of this particular patient that you want to offer the services, and then you can proceed and start or offer your services. And with this now, the process will be able to proceed, and the system at the tail end will be able to do a claim to be able to claim for that services that will be offered. Then for us to allow me to start that, and then I can be able to show you the last thing whereby for you to be able to claim, just want to highlight key areas for your claim to be valid or to be accepted. So you said we need to select the package and the intervention. This is just the same as what we are doing at the facility level. So we are picking this particular section on the consultation. It's be able to prepare the bill items. Then this is the service queues, so that you can be able to manage our patient within the facility. Then I can be able to start a visit. Then I'll be able to see the notifications. A bill was created, and this is the bill that we'll be able to claim from the SHA team. So what is the other thing that I needed to show? Otieno talked about the National Health Terminology Service. Again, this system has been integrated to have that. And the most important one that I just wanted to talk about is the ICD-11. And allow me to navigate direct to the clinical encounter because for our clinicians, they are the ones who interact with this, and they're the ones who mostly feel that. So, and when I talk about that, it's on the final diagnosis, which is a key determinant for us to be able to ensure that this claim is valid. So there's another section whereby the system has been integrated so to be able to have the ICD-11 codes. So right now you'll be able to see with this version, you'll be able to see the ICD-11 code and then the diagnosis. This has been now mapped as per the ICD-11. And for you to be able to claim, it requires this particular diagnosis for your claim to be a valid one. So I think up to that, that's all for the HIE section that we had planned to demo today. Over to you, Songok.
Thank you very much, Eric, for that interesting demo. And thank you, Otieno, for taking us through the first part. I think you prepared us to what was to come up in terms of a demo. Eric, I think you've indicated all the use cases that are available within KenyaEMR in the spirit of integration between EMR and health information exchange. And of course, you mentioned that this is available in our the new platform that's KenyaEMR or Taifa Care powered by KenyaEMR. And I think you also touched on the processes of claiming through or making sure that claims are done from the facility for purposes of ensuring that payments are made or claims and payments are made from from SHA. So I don't know whether there are any comments from. I know you want to take us through this with Patrick Wango, or you agreed that you are done with this particular bit. Is there anything else that is pending that Wango is meant to take us through?
No, Songok, that's all for today.
Oh, okay, thank you very much. Yes, so I think at this point I want to open it up for any questions that you may be having. I know the team here has been available to respond to the questions. Thank you very much, Frida, Moses, Adeline, Otieno, for responding to some of the questions that were raised on the wall. I really appreciate Kezia, Marianne. Thank you so much for being available to respond to some of those questions. I think that really helps in terms of even just reducing the time that we spend on these calls. So I don't know whether there are any, because I really don't want to belabor on going through the questions because they've been responded to. But if you feel that probably there is one or two questions that it may not have been responded to and you want to verbalize it, you can still go ahead and ask. Yeah, thanks. So I don't know, there's this last question from Shalom. She's asking, I'm not sure whether I really get the ICD-11 codes I've seen. Okay, fine. I think fine. I really don't understand the content of that, but probably maybe if you want to ask, you can. But thanks, Eric. I think you've understood what Shalom was asking, and you've responded. Buying time to just look out for any answers. I want to transition now and see whether there are any answers. Dr. Can I call you back, please? I'll call you back. Sorry for that. I forgot to mute. All right, so I'm not seeing any hand up. Does that mean that we are good? Let me just again scan through. Yeah, I'm not seeing any hand up. So I guess Otieno and Eric were very clear. I think the most important bit for us was the walkthrough. Okay, thanks, Frida. Yes, thank you. I can see some hands. Allow me to take this call. Someone is. All right, thanks. So, Renee John Ajuoga, I'm not sure whether I pronounced that correctly. We can, Ogutu or Otieno, you can allow Renee and John to ask their questions. We can start with Renee.
Renee has the mic. She can unmute and continue.
Thank you. Renee, go ahead.
Thank you so much, Bernard. That was a good presentation. However, I just wanted to, out of curiosity, I just wanted to ask in terms of having Taifa Care rolled out in facilities, and the facilities that are in some sub-counties. I'll mention Kisumu, KenyaEMR being predominant, and there appears to be another system, probably Tibabu, that will be rolled out. I don't know whether you are the right person to ask this question, or yeah. So in the event that we have a different system within the facility, how will it be made to communicate with another particular system that has been rolled out in a different facility?
Okay.
The other comment, probably, I would wish a reputation for those who were not able to get the sensitization in good time. Probably a repeat of the demo scheduled. Thank you. Over to you, Bernard.
Okay, thank you. Thank you very much, Renee, for your question. Maybe we can take John. You can go ahead. John, you have the mic. You can go ahead. All right. I guess probably John could be having some challenges with the mic. Meanwhile, maybe we can respond to the two. So there are two concerns from, I'm calling them actually concerns from Renee. One is whether we currently have an IL, or whether there is a possibility of data exchange between Tibabu, KE, and all the other systems with KenyaEMR. Remember, all the systems that are being rolled out currently, all of them are Taifa Care. The only difference is that they are being developed by different people. Like you will see Tibabu, you will see Taifa Care powered by Tibabu, you will see Taifa Care powered by KE, KenyaEMR, of course, so Taifa Care powered by KenyaEMR. So that's the basic, the only difference. In as far as data exchange, the interoperability layer, whether it's available, I think that's work in progress, and discussions are going on how to probably with time to actualize that. So as it is right now, I think unless probably maybe Otieno, you have any latest information, there's no real data exchange between let's say, for instance, Tibabu and KenyaEMR. Regarding your other question about repeating the session, we have these recordings are always available in the YouTube channel. Will guide you on how to access that. However, if there is need, I don't think there is any harm for us probably repeating the same session at a later date, because remember, the main reason as to why we do organize and plan for these virtual trainings is to build the capacity of all the service providers to be able to utilize the system and all the other platforms that are available. all the other HIS platforms that are available in this space. So one, you can access the recording of this training in the YouTube channel. However, if there is need, we can always do a repeat of the same. Remember, we've organized several of these virtual trainings. Once we are done with session 1, we'll again just go back to another circle of the trainings. Again, if probably there are any areas that you have challenges in, I'll request the team to also just post the toll-free line or the service desk line, so that in case you have any challenges, you can always reach out to the team. Otieno, I don't know whether you have any comment regarding the data exchange between Taifa Care, not Taifa Care, but KenyaEMR and Tibabu, before we go to Frank Maina. Otieno, any comment on that? Or Frida, you want to comment? Frida, you can go ahead.
Good evening, Franklin. Can you hear me?
Yes, I can hear you loud and clear. Frida, go ahead.
Yes, I've had the concern from Kisumu County. I just wanted to reiterate that we've had discussions with the county regarding the same. So in case another system is coming like the anticipated Tibabu, it will not be implemented in a facility that is already running KenyaEMR facility-wide. So it will be implemented in a facility that doesn't have facility-wide completely. So we are not going to replace the systems that are already in place. Back to you, Franklin.
Yeah, thank you, Frida, for responding. But I think Renee's question was whether there is currently a possibility of data exchange between probably Tibabu and KenyaEMR. But I agree with you. That's the guidance from DHA that the three systems, AFIA-KE, KenyaEMR, and Tibabu, if they're going to be rolled out, then it has to be rolled out in the whole facility. So I think the guidance from Frida, who is the focal person for Kisumu, is that based on the discussions that they've had, the Tibabu, once they set their foot in Kisumu, then they will be most probably focusing on, or actually they'll be focusing on sites that currently do not have EMR, because the expectation is that they'll roll out that system to cover the whole facility. Otieno, I know you had admitted at some point you wanted to make a comment.
I think Frida has already made the comment, and I think that kind of highlights what I wanted to say. That I just wanted to kind of reiterate to him that it is highly unlikely that you'll find one facility running Tibabu and KenyaEMR at the same time. Such duplications, I think, might not happen. And again, also, I think, which I think, Songok, you've already explained to Rini about the naming. What I'm hearing from Rini is that she feels maybe Taifa Care is a different system. I just wanted to reiterate to her that Taifa Care is just a branding by the Ministry of Health to ensure that we have standards. Regardless of whichever system that you have implemented, all the systems will be known as Taifa Care. So it will be Taifa Care that is driven by KenyaEMR, Taifa Care that is powered maybe by Tibabu, or Taifa Care that is maybe powered by AFIA-KE. So the Taifa Care is just a branding, but underneath it is just the KenyaEMR. Yeah, thanks, and over.
Thank you, Otieno, for just clarifying and adding your voice on the same. Yeah, so I know I'd seen a hand from Frank Maina. I don't know, maybe your question has already been responded to, or you still want to ask your question, because I'm not seeing any other hand up. And I'm thinking this should be it for today. We are looking forward to organizing another session next week. Maybe Otieno, a quick comment on the same. I know from the schedule that we'd shared earlier, next week we'll be focusing on a forum looking at Kenya HMIS community. I don't know whether that still stands. We are going to change tact a bit. Otieno.
Thank you, Songok. Yeah, so again, I just want to thank everyone for having time to join. So next week, we are going to have our final training, virtual training under the series for April-May. So we'll be focusing on a brand new solution that we are calling the the community forum, which is a platform that will ensure that everyone joins the conversation, everyone's voice is heard regarding all the HIS solutions that we support. So it will be a very novel kind of platform that we'd want to really sensitize and share with our community of practice. So I just want to encourage everyone to find time to attend that particular training and also share with the colleagues so that everyone is there. It will be a very exciting platform just to unveil it for the first time to the community. So see you there. Thanks.
Thank you. Thank you very much, Otieno. And I think from our end, we really appreciate the support that we're getting from your end, especially you being the lead. You're the one who's been really making sure that, of course, leading the other team members in Palladium in making sure that all these materials are prepared for us, and of course try to ensure that we build the capacity of all the service providers. At this point, I don't know whether we had any of our colleagues from the county joining us. I know I'd indicated that we probably wanted to just give them 1 minute or two to say our word. Frida, you can just prepare to close this for us. Meanwhile, I don't know that, do we have anyone from the county or anyone from CDC in the call, USID, DOD? Some remarks, if you're comfortable. If you're not, it's still okay. We will proceed, because I'm not seeing any hand up, and because of time, I want to request Frida to close this for us. Frida, over to you.
Thank you, Franklin. Good evening once again. So thank you guys for attending this session. It was very important. As you can see, we're having very interesting features that have been added in the system that we anticipate to roll out very soon. So it's something that has been requested for a couple of times by facilities, the HIE integration that we now have. So if your facility is still using KenyaEMR at the CCC, maybe it's time to rethink. I know claims reimbursement is a big deal to facilities. It's one of the ways facilities currently make money. So from this training, please take time to go and also capacity build your fellow colleagues who did not manage to join. Tell them of the exciting features that are coming next, and maybe just prepare the facility so that when the version is ready, we can be able to have this rolled out so that the facilities can be able to benefit from doing e-claims from the EMR, and also additional features that come with using KenyaEMR as a facility-wide system. So thank you guys for joining this call. We're excited to see how this will work out for facilities that will adopt this once the release is out. Back to you, Franklin.
Thank you very much, Frida, for those remarks, of course, on behalf of the team. From my end, I think I don't really have much to add. Frank, mine, I think your question has been responded to. Apologies, probably you had challenges in unmuting, but I'm glad that Adeline has been able to respond. I also wanted to just announce that in case you still have any questions, this wall is still open for you. You can still post any of your concerns. Number two, the toll-free line was posted on the wall, so you can always reach out. I'd seen a few colleagues requesting for personal numbers. I know in the spirit of data protection, we can't post people's numbers on the wall, but I think you can probably on the sites try to reach out to them on personal ground, and of course to support you in whichever way. So I know it's someone from, I think, Machakos who was to know who who is supporting that region. Mary Ann is not supporting that region. Frida, I know the Rini was requesting to probably get in touch with you. Maybe you can just have a side chat on the same so that you can support Rini. So Frida supports Kisumu, and of course we have other colleagues supporting other regions. Probably maybe in the next session we can also be able to just again reshare with you the contact people, not necessarily the numbers, but the contact people supporting the various regions in terms of HIS. At this point, allow me to then close and say thank you very much on behalf of Dr. Lily and leadership at NASCOP. Asanteni sana. Be blessed. See you again next week. Thank you, and feel appreciated. Asanteni and bye.
Thank you and bye.
Thank you, everyone.